Hey guys, what's going on today? Hope everyone's doing well. My name is Dr. Robert Fredrickson, and today I'm going to give you 3 unconventional tips for plantar fasciitis. So for those who don't know what plantar fasciitis is a debilitating injury that affects the bottom of our feet. The plantar fascia exists right through here. So they exist through the fascia through our feet. They help transmit force, but over time, through overuse and improper stretching, improper footwear, this fascia becomes restricted and it becomes tight. When this happens, it usually becomes painful. So that's when I say it's debilitating. It's very, very hard for people who have plantar fasciitis to move in the morning. They're very stiff in the morning, first couple steps. Very, very achy, very, very painful. It makes running, it makes exercise very, very hard to do because you have pain in the bottom of your foot, which is the foundation of our bodies. So instead of giving you tips and stretches that you can probably see in 1,000 other videos on YouTube, I'm going to give you 3 different ways that you probably haven't seen that might actually help get to the root cause of why you're getting this inflammation in the first place. Before I do this, if you're watching this video, please subscribe, please share with a friend. This can help people, more people with plantar fasciitis see this video and hopefully get them some relief. Okay, here we go. So most people are going to tell you to stretch, do a lacrosse ball on the bottom of the feet. I still advise that. A lot of people are going to tell you to still stretch the calves because the calves have a direct connection to the plantar fasciitis. And I agree with that 100%. What a lot of people don't realize is why are the calves tight? Why are the plantar fasciitis tight? Well, if you're watching this right now, you're probably sitting down. The majority of people sitting down have tight hip flexors. All right, so step number 1, address the tight hip flexors and the weak glutes. Like I said, if you're watching this, you're probably sitting down. And a lot of people don't realize that there's a direct connection with the way our pelvis moves, and the way it reacts, and how strong it is and how stable it is to the rest of our body. So the first muscle I want to target here is the psoas muscle. This is probably one of my most favorite muscles to work on because a lot of people don't realize that this muscle is either too tight, too weak, or a combination of both. The psoas muscle actually connects our upper body to our lower body. So usually it comes right through here. You can feel it kind of right in that front of that pocket. The psoas muscle is a key contributor to a lot of people's low back pain as well. Another reason for that is that we all sit too long. So what the psoas muscle does in combination with the iliacus, we call them the hip flexors together, is they start to pull because we sit in this position of a seated position, hip flexors get tight, and they start to rock our pelvis or pull our pelvis forward. Now our body, our glute max, glute medius, glute minimus are supposed to not allow this to happen, but they actually go into a state of inhibition, go to sleep. You know, a lot of people say it's a state of amnesia. So they fall asleep on it, so they're not used to be worked in this way, and so our pelvis gets this J-lo butt, or this lordotic state. So what happens to this is a lot of people don't realize if you have tight hip flexors and your body is this way, you are going forward. Guess what? Calves become tighter to help stabilize your body, which is the foundation. So a lot of people are stretching their calves, foam related calves for plantar fasciitis. Still advise you to do that. But one thing they're probably not doing is they're probably not looking at the hip flexors. So we're going to give you a few stretches, a few exercises for my favorite stretches for the hip flexors is going to be a combination of either the lunge stretch, couch stretch, pigeon stretch, 90-90, etc. And then we're going to give you some glute medius activation exercises to help keep that pelvis stable. And if you keep the pelvis stable, the calves don't have to work as hard. They don't have to stabilize as much. Guess what? Everything else kind of works downstream. So we're going to show you a few tips today that you probably haven't seen. Share this with a friend and let me know in the comments below if you found helpful. Okay, so probably one of the most easy stretches you can do. You can do this pretty much anywhere. It's called a lunge stretch. So the lunge stretch is designed to get those hip flexors, that psoas muscle, to loosen back up. Because the majority of people, this muscle is going to be tight from a combination of sitting, exercise, cycling also tightens up the hip flexors, running does of course. And so this is going to be tight on a lot of people. So what we're going to do is we're going to go to a lunge stretch. We're going to position our pelvis forward so we're feeling a nice big stretch through the front of our thigh. Now to get even more stretch if you're not feeling enough, take one hand over the other. Lean to that side. Now I have previous videos where I've shown a version of this called the couch stretch, which is this stretch on steroids, and it's going to really help target some of the quad muscle as well. But this stretch is good for everybody. Knock out 2 minutes of this stretch daily. Do 1 minute one side, 1 minute the other, and you're going to feel a big difference in the hip flexors. Okay, so the next stretch or exercise I'm going to show you is called a glute medius side raise. One of the most simplest exercises that I've found. I love this exercise for helping to strengthen up the glute medius muscle, which is a stabilizer muscle. It's an endurance muscle. Helps our body to keep that pelvis stable so it doesn't have the tendency to roll forward when we get tired or the other muscles are too tight to pull it that way. It helps reduce this force. Okay, so to do this muscle, or do this stretch, exercise, is we're gonna lay on our side like this. And I like to keep one of my toes slightly pointed inward, and I like to raise up. You're gonna feel a big pull through here, a lot of engagement through here, and you're gonna do this 10 times. Now, if you haven't done this before, it is okay to feel tired. So I usually coach my patients to do 10 reps to fatigue, 3 times, 3 sets of 10 reps. If it's too easy, with the toe pointed inward, is you can do circles, 10 this way, 10 the other. If you find that yourself is raising up really high, usually what that means is your foot or your toe is not pointed inwards. And so now you're focusing more on the TFL or the tension fascia lata and not the glute medius. So if you're doing that, you should feel it really right through here, point that toe inward, and then raise up. Okay, so we got the hip flexor stretch, we got the glute medius activation. Now let's go over the next step. All right, so now that you've seen the stretches and exercises that I recommend to help get the hip flexor stable, another thing I'm going to address for plantar fasciitis that you probably haven't considered is nutrition. So a lot of people don't realize that plantar fascia, like a lot of other chronic injuries, happens over time. Did you know that we start to lose 1% of collagen every year after the age of 30? Some studies even say earlier than that. So we start to lose our collagen fibers. Collagen makes up fascia, right? It helps make up tendons, ligaments, articular cartilage, etc. So doesn't it make sense to start to replace some of the collagen already? So collagen across the nutrition industry is a very, very popular supplement. But a lot of people don't realize that taking collagen in addition to doing exercise has major benefits. So a study that I like to reference, they actually looked at either physical therapy, eccentric exercises for plantar fasciitis, Achilles tendinopathies, and for tennis elbow or lateral epicondylitis. What they found is that when they combined physical therapy with collagen, a type 1 collagen, they actually had better results. And it makes so much sense because a lot of the injuries that I see that take a little bit longer are these chronic collagen issues like plantar fasciitis, like lateral epicondylitis, and like Achilles tendonitis. A lot of the issue is that the collagen is becoming either cartilaginous tissue, and so basically it's having irregular formations. It's not a resilient collagen that can bounce back. The tissue either becomes too tight and it has a hard time healing because of the lack of blood supply. So a lot of the stretches and exercises you're probably already doing for plantar fasciitis are going to help get blood flow to that area, but what tissue is actually getting remodeled? So a product I like is right here. It's going to have type 1 and type 2, which studies show makes up over 95% of the collagen in your bodies. It's also got magnesium. If you've seen some other videos, you know that I love magnesium, and I think a lot of people today watching this are deficient in magnesium. A lot of people ask, well, my blood levels say that I'm normal, and I like to say, well, blood levels for magnesium are actually just a small picture of magnesium. Only about 1 or 2% of the magnesium is actually in the serum at any given time. 60 to 67% of magnesium is actually in the bones, soft tissues, and more. So magnesium is everywhere. A lot of people are taking blood levels and it's not giving a true representation of the magnesium in the body. And so if you're deficient in magnesium, you're going to have a hard time forming new collagen. So this product is great. I'm not recommending any specific products on this video, but find a collagen that works for you, something that you can be able to take daily, and you'll notice some great benefits when you combine it with physical activity, rehab. So if your plantar fasciitis isn't healing and you've tried everything, physical therapy, chiropractic, soft tissue, rehab, active release techniques, etc., and it still hasn't healed, well, there's a new modality that I'm super excited about. I've done a lot of research on this, as I do with all things, that I like to consider for my patients, and this is something unique. This is called Shockwave Therapy or acoustic compression therapy. And so what is so unique about this modality that we have here at Fredrickson Health Solutions is that it is able to penetrate tissue and send compressive sound waves, okay? So think about this. Whenever you're foam rolling, doing a lacrosse ball, doing soft tissue work, Basically what you're doing is you're aggravating tissue to help send blood supplies to those areas to help it heal faster, right? The problem with that is that you're only getting so deep. Your body's has lots of fascia, has lots of layers of connective tissue. The plantar fasciitis area has a ton of fascia. That's why it's called the plantar fascia. And so the problem is with lacrosse ball and doing all these things is that you're not actually affecting some of the deeper layers. So that's where this machine comes in, because it actually can affect layers that you're not able to get without using this type of modality. This is the same technology actually used in hospital settings, lithotripsy. So we're using obviously a lower energy frequency setting, but this has so much evidence for, so much research behind it for plantar fasciitis, for heel pain, for heel spurs. So what it does is it sends a compressive sound wave, and I'll show what it sounds like in a second. And what that does, it helps re-engineer the tissue. So it actually turns a chronic injury that's not healing, doesn't have very good blood supply, and it accelerates it back to its original acute injury in a controlled state that allows it to start to heal with new blood, new growth factors, etc. So let's show you what it looks like. All right, so here's an example of shockwave therapy for plantar fasciitis. So I have my shockwave applicator, or my compressive device. I've put some gel on it so it can send the proper sound waves to the tissue. So basically you find your foot, I'm going to be working an area up and down, and then I turn it on, and you'll hear the compression. So ideally, when you find an area that's dysfunctional, you'll hold it there, and so the shockwave machine can do its magic. So it's going to start to send shockwaves to the area, start to send what's called a cavitation to the area, so it starts to break down. And then from the healing process that my body's going to do on its own, and I'm going to get the right precursors like collagen, magnesium, vitamin C, etc., it's going to heal. Okay, so you're going to hold it there, let that pain subside. And there you have it. So these are 3 different ways to help with plantar fasciitis. Thank you so much for joining me. I hope these 3 tips were helpful. I know the last one about the shockwave machine is not going to be available to everybody. But if you're in an area with a podiatrist, physical therapist, or chiropractor who has one of these modalities, it's definitely worth checking out, especially if you have chronic heel pain or plantar fasciitis that just won't heal. But the other tips, the stretches for the hips, the strengthening of the glute medius, taking collagen, supporting nutrients like magnesium, vitamin C, etc., can definitely be game changers. And I'm not saying that the other stretches are bad. Still lacrosse ball your bottom of your feet, especially in the mornings when those first couple steps are painful. Still keep stretching your calves. But these things I just showed you today will make all of those other tips and tricks that you've probably already seen more effective. So again, I'm Dr. Robert Fredrickson with Fredrickson Health Solutions. Please subscribe to my channel for more tips, tricks, and ways to live healthy. And hope you have a great day, and we'll talk to you soon.